All of us have mental health. No matter where we are on any given day, we all manage the ups and downs of life. At the Mental Health Center of Denver, we believe that everyone should be able to live their best lives. Because of the support of our community and people like you, we have been able to open the door wider with the hope of expanding access to care for everyone in Denver. Our Emerson Street for teens and young adults creates a welcoming community with a variety of activities and treatment services to support young people.
Emerson Street was created about 4.5 years ago. The Emerson Street is a site that serves 15 to 26-year-olds, and it was really born from noticing in the data that young people were falling off after child services and then coming back later on in adulthood into adult services. So we really wanted to capture that group and create a space that young people felt comfortable. And so it's one of Mental Health Center of Denver's only combined sites where we have psychiatric rehab and clinical services and prevention level services all housed in one. Another benefit for Emerson Street is increasing access to care within our own agency. By the time they age out of Emerson Street, we can really help plug them into other services within our agency. So they're really established with that next level of care. It's growing every day.
We meet people where they are and build partnerships throughout the community. Our co-responder program is a partnership with Denver Police.
This idea came about 3 years ago as a joint collaboration between the Denver Police Department, the Mental Health Center of Denver. The co-responder team is a group of social workers that essentially ride with Denver Police Department, engaging in mental health calls, behavioral health calls, and trying to bring services to a community that is calling 911 in crisis. At the beginning, it was kind of like a prove it to me kind of thing, and then as we kind of developed into that, our clinicians were able to help people get into services, and then the back-end treatment that MHCD provides. The second officers got that, it was like, excellent, now we have a resource that we never had before.
I think what makes the co-responding unit so successful is that really when the officer and the clinician show up, we're not talking about two separate entities, they're really one.
So the work that I do with the police department helps the community in that we are intervening in mental health crises when people need it the most.
This helps individuals in the community access care because it is delivering it directly to them.
Looking to the future, we are using technology to make mental health care more accessible to all. Our innovation lab is developing new tools to break down barriers and optimize results.
It's important for Mental Health Center of Denver to innovate because things change, environments change, people's needs change, and we have to be there to meet people where they are.
The Mental Health Center of Denver's Innovation Lab is focused on bringing technology into clinical practice. One strategy that we're taking with that is to invest in technology as a means for increasing access to care, for improving patient engagement, and driving treatment efficacy. One of the advantages of being at Catalyst here is we're exposed to other people solving problems in creative ways, right? People thinking, how can I use technology to make healthcare better? We're doing things that people have thought about before, but they haven't done yet. It's really exciting to be doing this work, right? Like, I'm proud to be part of an organization that, believes in the future.
It takes all of us